Hi, my name is DS Julie Allington, and until recently I worked as part of Operation Alloy, which is the op focused on mental health. Police officers regularly come into contact with people with mental illness and sometimes with those who are experiencing a mental health crisis. It's therefore important that we understand our police powers in relation to the Mental Health Act and what happens after we use Section 136. I'm here today with Sarah Jenkins, who is an approved mental health professional. Sarah works with North Northampton Council. We're going to chat about approved mental health professionals and explain more about Section 136 assessments. Hi. Sarah, can you explain what an approved mental health professional does?
AMHPs, approved mental health professionals, coordinate assessments under the Mental Health Act, including Section 136. AMHPs, or AMPs, are usually social workers, but also include mental health or learning disability nurses and have extra experience in training in the Mental Health Act. During the day, there should be 5 AMPs on duty covering both the north and west of the county. Out of hours, after 9 p.m, weekends and bank holidays, the emergency duty team by the Northamptonshire Children's Trust undertake this role, but this is limited to 1 AMP to cover the whole county.
So who coordinates a Section 136 assessment?
In Northamptonshire, doctors are not based in the same team as the AMPs. For Section 136, they are often linked to the hospital where the place of safety is, or they can come from the community to the hospital. There is a duty rota after 5 p.m. at weekends and on bank holidays. Custom and practice currently is for there to be a Mental Health Act assessment. This is the individual and maybe a family member or relative, 2 doctors, 1 employed by the Health Trust and a second independent doctor, often Section 12 approved, meaning they have expertise in mental health. There is no power to ensure they are available, plus an AMP. This is all coordinated, there is no set rota. These factors mean there can be waits for doctors and AMPs.
You may be wondering if the police need to use Section 136. Section 136 of the Mental Health Act is a police power, and in some circumstances we will have no option other than to use it. That is, when a person is deemed to be in need of immediate care and control due to their mental health. There is a requirement that the police take advice from a mental health professional before the use of Section 136. This is where Op Alloy and the Mental Health Hub and Liaison and Diversion Service can be used. If someone is able to engage, it might be possible for the person to speak to the Mental Health Hub directly or plan other options like using the Crisis Cafe to prevent the use of 136.
Both police and mental health professionals have to think about how we can do something differently when working with people to prevent mental health hospital admissions, and this is backed up by the law and statutory guidance. The least restrictive option of maximising independence is one of the current guiding principles of the Mental Health Act Code of Practice. 1.2 states where it's possible to treat a patient safely and lawfully without detaining them under the Act, the patient should not be detained. Section 136 is a police power which can last up to 24 hours to allow an assessment within that time period. If the outcome is no further action or a care plan, the section ends, or it ends and is replaced by another section.
Sarah, can you explain why people are not detained after a Section 136 detention?
National figures from 2021 say that 1 in 6 people have experienced a common mental disorder, something like depression or anxiety. Many people who have a mental health problem will be supported by their GP and will never come to the attention of secondary mental health services like NHFT, Northamptonshire Healthcare Foundation Trust. Although some services like the Mental Health Hub are about gaining easier access to all.
So what could the outcomes of a Section 136 assessment be?
As the Mental Health Act looks at a least restrictive option, outcomes can include no further action, NFA, which could include advice or information given, a care plan, so the person may be treated in the community either by health, NHFT or social care, like support in the community from NHFT or social care, or other agencies like S2S, Substance Abuse Solutions, or back to their GP. There are also crisis houses which are run by NHFT but are staffed by social care as a preventative services to avoid hospital admission. People can be referred to services as well, and this is not a shortcut to quicker to access. There can be barriers to access some services. There can be a wait. If someone can agree or consent to go into hospital informally, this can support someone's recovery. That's Section 131. Further formal detention under the Mental Health Act is most likely to be Section 2. A person's GP is always contacted about any outcomes.
Are there any other reasons why a person doesn't go to hospital after a 136?
People can be in a crisis, and this can end. Previous research has said that a crisis can last up to 72 hours. If someone presents as emotionally dysregulated and cannot manage their emotions, this can affect how they present. If people have experienced trauma, they can find it difficult to be resilient or to have coping mechanisms. People can experience care-seeking behaviour as this can give reassurance. There are some diagnoses like emotionally unstable personality disorder, EUPD, which can affect people differently. They may have experienced poor attachment as a child, poor family breakdown, abuse or other trauma, and this may affect how someone's thinking and feeling about themselves and also other people. People can experience emotions that are very intense, overwhelming or changeable. Their behaviour can be very distressing but are normal again once this has passed, and they would not meet the criteria for detention. Also, sometimes people can cut or harm themselves as a coping mechanism. People may also not be known to mental health services, but due to other pressures like relationship breakdown, bereavement, losing their job or home, they can hit crisis point and they don't know where to go for help. That can be why they come to the attention of the police. There can also be attention for people who do not accept help until they are in a crisis. So support teams or agencies may be in place to provide help, but the person doesn't engage fully. Services are also designed to provide input in the short term, and people can be discharged once deemed to be well. The Mental Health Act cannot be used to prevent future harm or distress, and all mental disorders will affect people differently. A person can't be detained unless they meet the legal criteria. Two doctors, usually psychiatrists, must make the medical recommendations. If this is the case, the decision to make an application for hospital admission is then made by an AMP. If there is no psychiatric bed, it's not possible to write an application and the person is not detained. Their GP or any other worker involved will be informed of the outcome, and AMPs also have a role to contact the person's nearest relative, which is similar but not same as next of kin, and inform them about the assessment.
Thank you for listening. We hope you found this informative. Thank you, Sarah. You can find information about Op Alloy and mental health resources on the Op Alloy Fortinet page.